go get checked for this fever because it was getting out of hand. And then let's see, I kind of embraced it when the Yahoo guys were like, I should just go to Rich Hospital, you know.
So even beyond the medical opinion, which is what I wanted to establish, that beyond the medical opinion, you yourself had reason to suspect that you would need some extra care because of the coronavirus scare. Great. Let's go to Rich Hospital now, because you went to Nyaho and you were asked to go to Rich. What happened there?
So I got a different encounter when I went to Rich. Nothing to be going on. No readiness. No feeling of, you know, there's something up our sleeves. I don't know if it's because of the exit I used, but if you are really familiar with Rich Hospital, there's an accident. That's where I passed. And everybody just kept directing me to a place that they did not even know of. Everybody was clueless. I was just expecting that, just like how I had gone through the process with Yahoo, there would be, let's say, a screening process for, let's say, people that, just regular people, as well as, let's say, specialized cases of, let's say, if you have been referred from a hospital because you are showing symptoms. This is a research center for this situation we are facing. And so I was just really surprised that there was nothing going on.
Okay.
I had to, yeah.
Okay, now, Baba. In the first place, it's one of the it's a referral facility for coronavirus. It's a treatment center. The word not exactly a research center as you mentioned, but you see, help us to picture what your experience was. So you got out of a car. Who did you meet on your arrival at Rich Hospital? Did you describe the situation that you had? Did you explain that you had been referred from Yahoo? And what did the person tell you? Can we know exactly in that sort of detail what happened when you got to the hospital?
All right. Now picturing vividly, I just got out of the car, passed through the gates. Nobody really asked me anything. I mind you, I had a nose mask on from Yahoo. So I mean, it should definitely, let's say, let some people, you know, raise some brows, like maybe, oh, it's just not precaution. I don't know. But nobody really seemed to care, to be honest with you. I didn't find any medical personnel around on the entrance, so I had to ask patients if they knew of any screening going on or like something like that. And so everybody directs me to say, okay, let's say go to where the nurses are sitting, and then I go there, and then they say go to the next block or this unit. Mind you, this was my first time going to Rich Hospital, so I had a rather frustrating tour. Nobody knew what was going on.
So when you got to the nurses station, Baba, because you were directed by patients up till you got to the nurses station, did you tell them that you had been referred from Yahoo because you were a suspected coronavirus patient?
Okay, when you put it that way, it's quite serious. But I told the nurses that I have been referred from Yahoo because I have a fever and my temperature is high, so I've been referred here to be tested for sampling for corona. And they keep saying, okay, go to the next unit. When you go there, ask where you should go. And it was on and on for like 6 times because nobody knew what was going on. Up until when I had to be with the, I think it was a maternity section where some nursing mothers were weighing their babies. So I was sitting amongst them with my nose mask and just going about my day. And so I had to walk up to one of the nurses doing a demonstration with the babies. And I asked her, like, I'm really frustrated. This is like over an hour. I'm really frustrated. I do not know what to do. I do not know where to go. And she instructed me to go behind the facility where we were, which was apparently the quarantine area where the positive patients were.
Do you know where exactly that is, this quarantine area? Can you tell us, for instance, when you were at maternity, where did you pass to get there?
So it's behind, I think there's a disease control section of Ridge Hospital. It has ironing sheets all around it. I think it's close to the mortuary, where the mortuary is. I don't know if you're too familiar with Ridge Hospital, but it's close to the mortuary. So there's a lot of, I don't know if it's a maternity unit, but then there were a lot of nursing mothers they were weighing their kids. So behind that facility, there is a barricade, and then there's a security, and I think there was someone else being around with nose masks. So
That's where the isolation facility is. So you got to the isolation facility. What happened there?
So I didn't want to believe it was the isolation facility, because the security that was sitting there just allowed me to enter, and he didn't have an N95. So I was like, okay, maybe this is just a normal barricade for security. I really didn't know what was going on. So I went there, and then I was asking him. I was really frustrated, and then he was like, "Oh, this is not the place for screening. So just go to the nurses; they'll direct you." And then, just as Ghanaian as I am, I just had to cross the scene to get what I wanted. So I crossed the scene that I'm extremely frustrated. Nobody's minding me. Can somebody just do something about this? Before I got the attention I needed. Before he went, the security left his post, irresponsible, I think, left his post and went to ask for help for me. So they directed me to one, I think Dr. Baita, I'm not too sure. And then I went to meet people as frustrated as me, 4 or 5 people in my shoes, just sitting there waiting for something to be done.
Right. Baba, thanks so much. And you were saying at a point that one of the health workers who was attending to you was not wearing a nose mask, and you drew his attention.
Yes. So while we were, these 4 or 5 people I was talking about, we were, in limbo. That's when we saw there was no prepared place, so they were now, trying to, let's say, arrange tables and chairs to try to screen us or something like that, get some testing going on. And I really didn't want to. I wanted to give them the benefit of the doubt, but I was really disappointed, because even when we were sitting waiting to be screened, there was nothing like should I say, like, some distance observed. I was just sitting by the next person who may or may not be positive. There was nothing like gloves. The nurses. The doctor he was not wearing gloves. He didn't have an N95. Was just the usual nose mask. They weren't wearing plastic aprons or anything of the sort. It was just like I think they took it too lightly. And this same doctor is the person that may or may not have confirmed other people positive. So you have come into contact with people, positive or not. So I just felt very disappointed.
So, Baba, just to be clear, from what you tell us about your Rich Hospital experience, the facilities are there and ready. The people are ready to test you, and thankfully, of course, you tested negative for coronavirus. The people were ready to test you. The facilities were there. The isolation center was running. The people had available nose masks. But from what I hear you describe, the handling of the system by the staff is where you raised questions.
Maybe at the time you ascertained this information, possibly yesterday, maybe at the time they may have, because some of us left there causing scenes and just raising an uproar because we were outraged. But at the time we were there, trust me, there were no nose masks. The doctors kept asking for N95s. There were gloves there, yes, but I just don't understand why you wouldn't use the resources that you've been given.
Are you talking about in the isolation facility that there were no nose masks?
Not in the isolation facility, where they were doing the screening for us, the sampling and possibly triaging. There were no nose masks for even some. So I still had a whole nose mask on for all the 4 hours I was there, because Rick didn't give me a nose mask.
Okay. Baba, thank you. Thank you very much for joining us. So that was Baba, who started showing symptoms familiar that we know to be familiar with coronavirus. And she visited the hospital and she has quite an experience there. Kojo, you're trying to reach Ridge.
Yes, we're trying to speak to the Director of Health, Dr. Srofenu. We sent him this lady's story yesterday and asked for a response. He hasn't got back to us yet, so I've been trying since yesterday to reach him and get a response from him. We'll continue to try so that he has the opportunity to speak to these issues.
But what do you guys make of this assessment of this, Winston? We've hardly heard you all morning.
Yes, it actually tells about our preparations. Here's a situation where, and you talk about once you got to Nyaho, they took control of the case, then they, referred her to the Ridge Hospital. It would bring us to the point that the Ghana Medical Association makes for us. They're talking about the need to ensure that those who are within the frontline, healthcare get to appreciate the situation they're dealing with. It doesn't look like they appreciate what they're dealing with. It doesn't look like they know, the challenges that we're being faced with. It looks like business as usual, normal hospital environment. You get in there, nobody cares. They tell you, move on to this location, move to the next location, and that is simply how they are treating it. Because for a facility like Ridge, which is supposed to be the management center of, coronavirus, you do not expect these things to be happening. Well, we're here to hear from, Dr. Srofenu, so I just would hold on until we hear from him.
It's a very important point Winston raises there, Kojo.
If I may add, the authorities have already been communicating with us the proper way to access healthcare. Now, I don't know why Nyaho simply asked her to walk to Ridge, because that's not what the authorities have asked us to do. They say if you feel that you are suffering the symptoms, call these numbers. When you call, they will give you instructions on where to go. Now, I don't blame the patient here. She was doing what she was asked to do. Nyaho asked her to go to Ridge, so she did exactly that. But whether that is the most effective way of reporting yourself to these designated facilities is a question we must find an answer to. The authorities have said, no, don't just walk in, call, because I suppose they understand their own shortcomings, that not everybody walking around at Ridge has been trained on the proper way to manage a suspected case.
Or shouldn't there be a designated, if you suspect that you may have the coronavirus, when you get to Ridge, there should be some signboards that say designated, go to this place?
Yes, so what we are told by Dr. Srofenu in the interview I had with him is that they now have something called a pre-triage. So before the regular triage, where you just go into the outpatient, sit down, wait, be seen, and then they take your obs and whatever and decide where to send you, there's a pre-triage because of coronavirus. Now, these people are going to check whether your symptoms are, suspicious. If they are, then they will send you to the right place. But it appears that pre-triage system, she didn't even get the opportunity to start that, because she walked in and she was just treated like a normal patient. You understand? So clearly there is a problem at Ridge. But the point I'm trying to make is Ridge probably foresaw that these things can happen. The Ghana Health Service probably foresaw that these things can happen, and so advised that instead of walking in to a treatment center, phone ahead. So they can expect you and send you to the right place. I want to reiterate this, that if you do what we've been asked, if you follow the instructions, it's safer for you and safer for everyone in the hospital, in society as well, if you follow the instructions. Because look, our healthcare system is crippled. We are trying to manage a global pandemic with a crippled healthcare system. So the best we can do as patients is not to overburden, overtax the system, but to follow the instructions that we are given by healthcare professionals. I certainly don't blame this patient. She was following the instructions given her by Nyaho. But did Nyaho follow the protocol? That's a question I would love to hear an answer to.
Yeah, because anyway, in healthcare systems, even if you are referring a patient, you call the facility you are referring to, right?
Yes, you call ahead, let them know. I mean, I guess in this case, you don't always, the system that I'm used to, there's a database and all of that. So once you do the referral letter, you send it, to that facility. They are able to tell on their screens or through their IT system that this patient has been referred, appointments booked and all of that. But obviously this is quite a different scenario. I have a lot of questions this morning. So what I'm gonna go and make some phone calls, because I want to kind of see how the system works.
Hetty Mante from Audome Estate says, good morning, Daniel. First of all, Baba shouldn't have gone to Ridge alone. She should have moved in an ambulance. I'm so sad Very sad. This is Hetty Mante from Audome Estate. Because I'm thinking about it. If she wasn't wearing a nose, well, she was wearing a nose mask, which means that she couldn't have spread the virus.
That's Baba.
Right?
Baba was worse. So you see, the thing is, Baba
it limits her ability
but she also took a lot of initiative, probably because she could. She's obviously very well educated. She was protected. She has a nose mask and all of that. But what about those who do not have nose masks? What about those people who are just maybe in pain, who are coughing and sneezing and not covering and have just come to the hospital like that? And so they've come, they're sitting around, you're sitting next to somebody, the person is sneezing. There are times when I've gone to the hospital with asthma and I'm sitting and somebody's sitting next to me and they are sneezing and I'm irritated, and there was no corona at that time because I'm thinking, look, I'm already showing these symptoms. You're cold, you're coughing, you're sneezing, you're doing all of that. So really it should not be like that. The systems have to be in place, because remember that the problem with the face masks is that, one, it has shown that people are touching their faces more, and two, the more people who don't need the face mask are using them, the more the people who actually need them are not getting access to them. So the face mask is not really a long-term, do you get what I mean? The long-term thing is the systems must work. When you call, the phone must be picked up. You must be directed where to go. When you get there, you should have minimal contact.
Right.
Because remember, Daniel, that if you get to rage with coronavirus, for example, and I get to rage because I'm having an asthma attack, and we're both in the same space, you are putting me at risk of getting, the coronavirus, and I am already compromised, whatever, because of the pre-existing. Do you get what I mean? So it's like these systems just really have to work so that people who are not feeling well are getting treated, but also so that people who are not well with other things are then not also at risk of getting this on top of that.
Anymore, I get the situation that you're raising so well, and it's important that we keep all of this in mind as we continually test. Remember, we have been reaching hospitals since yesterday trying to get a response. We have not done that. We've not been successful yet, and so stay with us. We would speak to them as soon as we have that response from them. However, in the meantime, let's go to Takoradi, because we started off by asking how coronavirus is changing your daily routine and how your life is different, the way you live is different because of this coronavirus scare. We went to Takoradi to find out exactly that question. Natalia Kwanta has some answers for us.
Yeah, sure. You can see people are really ready to protect their hands, protect their nose, protect their faces. They are really ready to do so. But the material they need to do so, they are not getting. So if you give me opportunity to suggest, I would suggest that there should be more production in Ghana rather than depending on the foreign countries where we import these things, so that the supply will be more and people will get it for all of us to be safe.
Disease has started from abroad, and recently we heard that it has got to our country. So prevention, everything, I have to cover my nose and have my gloves to prevent the entry point of because they told us the things pass through our nose, our mouth, and that is our eye. That is why I've covered all this place.
Them in your gloves and rubbing alcohol. Let me protect them. On internet, I have fast myself because make sure TV and social media. Most of Europe countries are yaban was for this one. That means you are shop was sauce when you've been top. Okay, gloves, rubbing alcohol, hand sanitizer, wash short hook, internet. Or them may have fast and much of the dance. Son of a sister, but son, why it makes my name in so. Okay, I just know, no car, or yeah, ACD. But it's another one, come on, ACD, no, I can know 25 cities. But so no, I did what's up because this man, I don't know, Manka Samukun over Netherlands, also I shot and even so. And this happened to also 100 cities in Prague, I did so, for security reasons. And Session Frank at 25 no. Oh, yes,
man, I'm a starter, mommy, a hairdresser. No son don't call fully be so distant in a market for the Morton. Martin, one a pair, mammy, you've been taught, was short, and so many dollars ton. No markup and so much, the am do question. Or the mom 2 cities. No, most of 2 cities.
So those are some residents of Takrady talking about how they are coping with this coronavirus scare. They're talking about how the prices of some things like hand sanitizers have gone up. They're describing, how they've had to shop and stock up for some of these things. You had a number of traders as well who are talking about why exactly this has been the case. It's 25 minutes to the top of the hour, 10 a.m. We want to know what has changed in your daily routine, how you are coping with coronavirus.
We can move from the ghetto one day.
Deborah Jane is CEO of Mahogany Events. It's important that we understand how event organizers are going to cope with this situation where the president has banned public gatherings.
And Daniel, we decided to speak to Deborah because I was showing you this morning, a friend of mine was getting married in a few weeks. And this morning I got the invitation sent back to me, but this time red taped with cancelled. So we know that a lot of weddings are being called off, a lot of funerals are being postponed, even naming ceremonies are being done very privately, now. And so a lot of the things that we look forward to in terms of socializing and stuff like that is being affected. Now, the other side of this is that the people who are organized, because the thing is that sometimes you are given an advance, you're booking chairs, which Deborah is going to tell us about, and then all these things have to be cancelled. So that's...
Yeah, so Deborah Jane is CEO of Mahogany Events, and she's going to tell us how that experience has been for her. Good morning, Deborah. Thanks for joining us.
Good morning. Thanks for having me on your show this morning. This topic, it's actually caused a lot of panic to the events industry, to be honest. And it's not just us, the planners, that are actually immediately affected, but all the people whose livelihoods depends on these events. All the waiters, the setup crew, the truck drivers. So there's a ripple effect on the entire cycle. Every stakeholder involved is affected by the decision to cancel or put all gatherings on hold. Now, what we would say, because no matter what, Corona is going. It's not here forever. We've been assured that people are still going to get married eventually. Birthday parties are going to still happen. Anniversaries are going to still happen. Now, what I would advise clients to do is postpone rather than cancel. Postpone without a date, because what happens is all your deposits that you've paid, you're not going to get all of it back when you cancel. And that is the honest truth, because vendors have already invested their time into planning your events, or some have already bought things towards your events. When you cancel, you're not getting that money back. And when you do come back to rebook them, it's going to be a fresh start. So postpone so that you know that your money that has already gone into this thing is secure, is there. So whenever you are ready to continue, at least the money is there. Do you understand what I'm saying? But when you cancel, you're not going to get the money back. And then when you come back, okay, now decide to do it again, we're going to treat you like a new client. So we're telling people postpone and confirm a date later rather than cancel and demand a refund. You are not going to get 100% refund.
Right, Deborah, I love how you capture the broad picture of the number of people who are affected by this, and even end it with some advice for clients out there. But what's your personal story? How many events, for instance, did you have in the next 4 weeks? What have you had to do? Are there clients, for instance, who are telling you, okay, I'm going to reduce it to 25 people? Help us understand what your story is.
Okay, so my particular story, I've had events cancelled. When I said, if you cancel, I'm not going to give you your money back. It's okay, let's hold on and postpone to a later date that will confirm later. But I being me, I would not spend that money regardless, because the client can always come back and say, we've actually decided to cancel, and I would have to refund part of the money. A lot of time has gone into these things, and it's panic for me because I'm not getting an income this month, but regardless, I have outgoings.
What are those outgoings?
I have employees, full-time employees that I have to pay salaries for. I have tax implications. Whether I've done events or not, I have to pay income tax. Whether I've done events or not, I have to pay corporate tax. Whether I've done events or not, I have to pay SNP and private pensions. So I still have outgoings, whether or not GRA is still going to come to me and say, hey, madam, you have to pay your corporate tax for February or March, whether or not you've worked. So that the government is still expecting us to pay what we owe them, but then they've asked us to put everything on hold. I know it's for our own safety, but
on the flip side as well, I know that there are other jurisdictions where, because of these lockdowns, some reprieve is being given for businesses like these taxes and what have you. But just so we understand and we're educated, for the corporate tax, it's a percentage of profits, isn't it? So that even this month that you've been in lockdown, you don't have any profits, you won't pay the tax, or?
We are charged annually and we are asked to pay quarterly, every 3 quarters. And the tax is based on assessments of the year before.
Okay.
So
are you able to explain to the officials?
Every quarter.
But if you are paying this quarter, are you able to explain to the officials at GRA, for instance, what the unique situation is that we all know? I'm just asking if that option is available for you so that you can...
Well, this is the first time that we've all encountered any such thing. So I guess when I'm going to pay the next quarter, which is the beginning of next month, I can raise it with them.
Great. So that's one great idea. But tell me, how are you innovating for people who may still want to hold events at this time and would want to keep them quiet? The president said you can have a private burial service, for instance. What are those ideas that you are going to apply?
You know, truth is, yesterday, one of the event industry lady sent me a message and said, Debbie, I'm in a fix. Somebody wants to still go ahead and have a baby's naming ceremony on Saturday, and it's 50 people. She insists it's private, but I don't know what to do. And what I said to her is, right now, you are putting not just you, but all your staff at risk. Weigh the option. Is that profit margin worth it? I always think about the other people involved, not just you. And is that profit margin really worth it? Some people are still insisting on having their events. I personally say, you know what, hold on. Let's give it 1 month like the president has asked us to. Do not put anybody's life at risk. Not for your own benefit, no.
Well, that's definitely a mindful decision to take. And is there any fear within the industry? You know, you were talking about how you still have obligations to your staff and what have you. What's the general mood within your industry, which basically thrives on public gatherings?
Well, there's a lot of panic. It's inevitable. Things like this causes a lot of panic, and you're thinking the money I have now. And, you know, the market women are happy. They're saying, oh, people are shopping like it's Christmas, forgetting that they will not have any new stock anytime soon. Nobody's importing. And do we spend what we have now? Do we try and spread it across for the next 3 months because you don't know what is happening next? But however, you know, one observation I've made is the world was moving very fast. Sometimes we don't even have time to think about, to even evaluate how the day went, to think about how to reinvent ourselves. And I've said to my staff that do not think that just because we've been told to take it easy and be at home means we have nothing to do. This is the time to, and it also got me also thinking that, okay, hold on, I have been depending so much on events, and this is an awakening. So if events come to an end, what else can I do to bring an income? So I have been thinking about it. I'm like, this is a rude awakening for a lot of us to actually start thinking, what is the plan B? We need to start coming up with ways and other businesses that will keep income coming in cases like this. So I have been thinking, and I have told a few of my students, you know what, this is the time. And I've told my staff, start thinking, what else can we do when we don't have events? We've been so dependent on events or small services to other event professionals that we have relaxed, maybe overly confident. But this rude awakening is maybe what we all need to go a step ahead.
I must say, Deborah, that I like the way you are thinking through the situation and even thinking of diversifying it. But before you go, you were earlier talking about how next month or at the end of this one, you would have to have a conversation with the GRA and talk about, you know, what your tax obligations will be. These are conversations that have started in other countries. Is this your expectation of the authorities that they should offer some reprieve for businesses that will lose out in this period?
Well, I think by now they should have concluded on what to expect next month and what they're going to offer us. Because all of us are going to go in with a case, that's for sure. Okay. And you'd call on them, for instance, to consider you and not charge you so much tax? Yes, definitely. Right. Deborah Jane, thank you so much for joining us, and all the best in this period. From the conversation we've had, I trust that you would weather the storm very brightly and come out even stronger. She's CEO of Mahogany Events, and not to sound bashful, but it looks like she definitely has a plan that she wants to work with. And Winston, it's time to get inventive if you are in the area.
Exactly, you'd have to invent when you find yourself in these situations. As particularly, when I heard of the cancellation of the wedding, I was saying to myself, well, this probably could present as an opportunity to have very private events also.
Smaller weddings.
And, as Africans, marriage itself is between two families. And so you can agree to have your father and mother and siblings come together, and maybe you're bushing opinion, and they would agree that indeed you are married. But in the absence of that, if you want to have a big event, then what you have to do is to wait. And I'm happy that people are actually waiting. It means that we are all mindful of the current circumstances that we are faced with. And so wait patiently. If the ban is lifted in 4 weeks' time, if it becomes safer in Ghana to have these events, why not? We can go ahead. But if we still insist on having events, which I think sometimes there could be a blessing in any situation, have it as a private occasion and you're good to go.
Well, I'm thinking about it from the other angle as well. I mean, at the end of 4 weeks, will Ghana be safer? Will we have a reduction in new cases? Will we be in a position where we can lift this ban, or will there be a need for even stricter sanctions? It all depends on the decision making and the leadership that we see between now and 4 weeks from today. Already we are seeing some areas that require tightening. So let's see. In 4 weeks, I want to be hopeful, I want to be optimistic and say Ghana can beat this. Even though countries like Italy, America and so forth have struggled, I want to say that if it's just down to decision making and leadership, there is an opportunity for Ghana to be safer 4 weeks from now than it is today. So we can look forward to some of these things. However, you also have to ask what to do in the interim. So a colleague of ours has a funeral coming up in 2 weeks' time. Right, a funeral. Now you can't have a funeral unless
it's a private burial.
Unless there are only 25 people. So which 25 members of your family are you going to invite? You, your siblings, their wives and husbands and children, already that's 25. How about the uncles? How about the aunties? How about friends and family? How about colleagues? So what is the practical way of reducing what is usually an event for hundreds to 25? We would love for some of, in fact, I would have loved to hear some ideas from our event planner, whether there are practical ways of doing this. How do you whittle down a guest list to 25? Is it even possible? And if it's not, then what will that private funeral look like? Still maintaining our traditions and cultures, and what will it look like?
For her option was that, look, just hold on for now. Let's wait for the 4 weeks to end. I want to put this question, though, to the listeners. How do we cope with this coronavirus situation? How do you carry on life as usual when we are staring out this outbreak?
Can you carry on life as usual?
Daniel, I've been to wedding ceremonies that had practically about 10 people.
Yeah, my elder brother's wedding had
10
15.
persons. Yes, so that is doable.
How about funerals?
I'm coming to that. The challenge with funerals is that as Africans, we seem to love the dead more than the living. We seem to. And so when it comes to funerals, in my tradition, you can actually bury, which all of us would do. You bury the person and wait. So the funerals would have to be put on hold until it's safer to have them organized.
Okay, you can bury and wait.
Yes, you bury and wait.
And have the funeral.
In fact, in my village of Mpoho, it is decided.
You have like 10 villages.
Oh yeah, a lot of places. I'm a man of Ghana. You have funerals organized, maybe if there's the third week or so, a lot of families would then organize their funerals. And could you see, when they are done, we'll see Guao baby. Then people would go, and if you have donations for the families, you go and so it's like in a week you have 3 or 4 funerals, and so that can always be worked out. But you go ahead, have the person buried, and that's the end of it.
That is the end of it.
So again, which 25 members of the family will attend
the
burial?
The burial.
The burial.
After the burial.
After the burial, there's nobody who's supposed to.
It can even be just a nuclear.
In fact,
when we go for funerals, when we go for even a big funeral, only a few people go for the actual burial.
Exactly.
Yeah.
Really?
Yeah.
And it's never less than 25.
Oh, I'm foreseeing a situation where it can easily be brought down to. I have private burials.
Okay. Anyway, I mean,
it's a ceremony.
We need to have a way. So if you guys can see a way, then I'm glad. Because there's a lot of concern and worry among
You know what? Our listeners may have some very interesting ideas on this. 0302216541 0244340437. Text messages are brought to you by Glyco Travel Insurance Policy. Glyco will cushion you for life. And Afrodan, your back must last you a lifetime. Now, whenever you buy any Toyota Yaris 1.3 or 1.5 liter from Toyota Ghana, you get either a mega discount on price, free fuel, or 1 year free service with manufacturer's warranty of 3 years or 100,000 kilometers, whichever comes first. Offer is valid while stocks last. Drive the Toyota made for Ghana from Toyota Ghana and be safe. Our branches are Accra, Tema, Kumasi, Takwa, or Takrade. Or you can call 0302-910-204. Toyota Ghana Limited is proud to be associated with Joy FM, Joy News Arrive Alive Safety Tips on the Super Morning Show. Bedrock is also proud to be associated with Joy FM, Joy News Arrive Alive Road Safety Tips on the Super Morning Show. Experience the Bedrock 3 where claims up to 3,000 Ghana cedis reported before 3 p.m. are paid the same day. Bedrock Insurance, protecting the things you truly value. Now, in the beginning, children in her community used to walk to school. Today, not only are her bamboo bikes making it easier for children, Bernice Dapa employs many women as well. Ghana, in Absa, this is Africanacity. Africanacity is our inspiration behind who we are and what we do. It's our commitment to helping people find a way to get things done. We love Africanacity. To find out more, visit absa.com.gh. Now, everything is better on the brand new smartphone. Pictures look better, battery lasts longer. Your swag just they saw. Chese, you be raising with level and kasa. So how about getting a new one from MTN? This is a new decade, so get on with the times, and it's so simple with the MTN Raise Your Level promo. All you have to do is do more on your MTN phone and win a sleek iPro 5S. No lucky draw, just talk more, text more, and win one of the over 20,000 brand new iPro 5S phones. This year, the Raise Your Level Kakra, just dial star 120 star 1 hash to register today. We're good together, that's why we did for you everywhere you go. Hey, the person who coughed, I hope you don't have any. Reverend Acosta is my first caller. He's coming from Kumasi. Good morning, Reverend.
Good morning. Good morning to you, your listeners as well. I would like to say something about the funeral. Even as for me, if one of, God forbid, if one of my members dies, I'll do a selection. Me myself will not include. I will not include myself. If you like to go, well, why are you? We have. If it's possible for me to hire people, 10 people to go and bury my sibling or whoever has died, I will hire them, and I myself wouldn't be involved. This is not normal times. The president says. Even our church, immediately I heard the news. We have some branches that the membership is too small. Some of them is 20 people, 30 people, but you don't know where those people are coming from. People they have contacted, people they have mentored before they enter into the church. So it's important for all of us. Even my branch, Bao Foundation Ministry, I heard us in Kwanzaa of Boise Road. We are having mini harvest this Sunday. We have postponed those things. We don't have any trouble. We don't want any trouble. So we have postponed those things. We are not going to do any harvest. Money is so important for human life. So we cannot actually. We have postponed everything. We do WhatsApp or voice message. Preaching to some members. Let's pray. We have to pray. And for God, heal this land or protect us until the 1 month. If the situation is it's okay, I think we can go to church. Like
Okay.
you going to church is not that you are serving God. Serving God, we serve God wherever you are.
Thank you so much, Reverend. Pakojo is on the line from Ashoma. Good morning, Pakojo.
Good morning, Daniel.
Mm-hmm.
Daniel, and good morning, Kojo, and to everybody. Thanks for the education. I don't know whether you remember Emmanuel Afo or the spelling bee, but Daniel.
Oh yes.
Quite important. Let's know this. I believe we are all doing everything we can in the preventive measures. I just want us to please educate me if I'm wrong. The packing of the number to 25 doesn't mean that automatically it is safe to be amongst 25 people. Even if the numbers are 3, if the number is 3 and one of them is exposed, and we haven't taken the preventive measure, so let's hammer. I mean, I've heard a lot of this, but we are not up to 25. We are not, and we seem to be going with it as if when they are less than 25, it's safe. Our contact tracing is working, but we know there are a lot of people who are exposed who are not coming out to declare themselves, that self-quarantine thing we're talking about. So let's hammer on the education that it's not just 25. 25 people who are all operating word, all implementing the safety precautionary measures. Good morning, guys.
Good morning, Pakojo. Thank you very much for adding that. Isaac James is on the line from Abokobi. Good morning, Isaac.
Good morning, Didi. How are you and all my friends over there?
We are all fine, Isaac. Let's hear you.
Thank God. Yeah, Didi, I want to see that the Nyaho situation, please, we put the blame on Nyaho because as a hospital, they should have put the girl as they see signs of or symptoms of the virus. They should have put the girl in an isolation room and call the emergency center for them to come and take samples to go and test it. If it turns positive, then they will bring an ambulance to take her away. So a hospital like Nyaho should have done better. Please, all other hospitals should learn from this. Whether private or public hospitals, they should make sure that if somebody come with the symptoms, then you see that these are the symptoms, put the person in an isolation room so that you call the emergency center to come in and take the samples.
Isaac, very important point there. Thanks so much. Elvis is on the line from Tema Community 25. Your last caller, Elvis. Good morning. Thanks for joining us.
Yeah, good morning. Good morning.
Yes, Elvis, you're on air.
Yeah. I want to contribute on the power outages issue. I don't know if
go ahead.
I want to ask, where is our information service? You know, during those days, in our days, when they want to have put power off or water or anything, they will come around and give announcements. But nowadays, nothing. And done. You know, we are in the era of paying for the power now. We pay for the prepaid and other things. And we have our monies on the light power, but you know, when they will just come bypass you and put off the power, giving you any information.
Elvis, thank you so much. Unfortunately, I think the line is a bit unclear. It's a bit spotty there, but I think you made your points. Thank you so much for calling, Elvis. You're live on the Super Morning Show on Joy 99.7 FM. Those are all the phone calls we can take. And this brings us to the end of today's Super Morning Show on Joy 99.7 FM. If you were supposed to get married during this month and you can't hold the wedding, tell her she's still your sweetie pie. Tell him he is still your sweetie pie. You've been with us from 5:50 a.m. till now. You're our superstars. You're our sweetie pies. From all of us and our production led by Sami Dami and Papa Yawasari, have a great day. We'll be back tomorrow.